Itagat chitab kolenjin ngetestai ak tetutienyo nebo tililindo eng yuton bo Kass TV kimite ak Daktari Dr. Kimutai Sylvester kobun sipitalit nebo Tenwek. Daktari, kageng'alanen ng'alalet neo nekakenyoru eng kebeberta netai ko koimutiet neo eng field nito nebo surgery anan engset ko rorunet noton nebo chepkondok anan chemayeme ako man sipitalit noton nebo Tenwek kiotiemen kasarta nekoyoker kole ko accommodaten chitugul nenyone konyo kochengchinigei kanyoiset eng sipitalit nebo Tenwek. Kaing'alanen otinye donors ak mara programs alak cheokere ile komuch kotoretok biik chekwone kocheng'e kanyoiset kobaten oret age ne labda ocheng'e chepkondok chuton ko tos ortinwek aichon kora mara mi sipitalishek alak chemuch kokere kole tos kiyai ne sapkoro kenyoru akot achek chepkondok asikeker kele kakitoret biik chechang chekwone sipitali kobo kochengchinigei kanyoiset. So koi sipitalitab Tenwek tos mara mi ortinwek alak cheokere ole oboisien chetoretok okere ole konyoru chepkondok.
Kongoi en tebutyono. Ko inamde kokimng'olole ng'alekab healthcare financing. Ui kidogo ako ngunon en Tenwek Hospital ko AGC Tenwek Hospital ko it's a non-profit organization. So and mbagele non-profit ko makilene kitindoi biashara anan nekiyae sikomuche kokone rabinik at this point. Kawaida en ngalekab ngele Mission Hospital most of the time ko magele katindo rabinik icheket tienge collaboration. So en ngalekab healthcare komoe collaboration hospital to hospital, sipitali akoi sipitali, and then government. Government go county, national, yaje go tuyogei bichu tugul asiko keng'alalen akele kitoreto ano biik. Nibuchi as a mission hospital komomi or age nemuche kenyorun chepkondok asikele kakitoret biik. So not amune king'alale ng'alekab marathon. It's the first time kiyaen netai kiyae en Tenwek tom kiyae. Kibwote kele sikiyae every year. Why? Kimoche ke rabinik kakinyoru ke channelen to this compassionate or needy fund.
Okay.
So ngunon from January to now kokoketoret biik between 19 million ak 23 or 24 million. Biik chekimamuche kolipanchike. Where did you get that from? Kukinyoru en just well wishers, some corporates lele na motoret chito agenge. Even an individual ngunon imaile you volunteer. There are so many ways. Saida kosase chi siling bokol, siling bokol ang mut, elibut, makisase neteno ndamun mengen. Bako kochanga biik chikako ko toreti leo. Ako kine kichamen ko magele kiome, we are committed keikun transparent and do kekiye, especially as a hospital. Kitinda like a social work department. So kine muche koyai bichu social work ko chikili kole iyobu and tos itindoi chepkondok, tos itindoi biik chetoretin. Iker kole mami iune en ngalekab chepkondok. Yon ikere ile matindoi ketoreti. As I said, kokoketoret biik chekachanga. 23 million ngeten January akoi nguni ko mo kidogo. Ibari ikero kotomami biik chetoretech anan ko feeden into this compassionate or needy fund komakoi. Ndamun tegemeo nenyon sikemuch kotesta. Nibuch magiu private hospital nemuche koyai biashara. Noton amune the cost and the healthcare intern ko mi ngweny. An operation nikoyoche koik 8 million in less than 2 million. That is why. Ndamun kiyome keib tuguk koik at the cost. Just koyam kele kakiliponchi kit nekakialen koyamen kou nondo.
Kemwa marathon mara iororwech mara en koindo tos bau otokchini labda oyum chepkondok chetiana ko mara chi meche ko participaten ko yoe ne?
So marathon we are doing it not in isolation. It's through also Athletics Kenya. It's already approved. Piche imuje ilabat o tinye itaga. Mi t-shirt ne kiallo mi raffle neteseta mi pay bill nebo nebo tenwek ne muje igon. Got kabogol mu tie much. Got ko millionit ke mwa gongwe. Ndamun tugu choto ko bendele yoto magele poko mondoe. So on 7th September committed that marathon and Bomet kirwe o nega sinda niziki goen tinda prize agine. So injia moja negimuche kenyorun rabinik. Target nenyo negimokte 100 million. Because that is around in every year around 150 million chegemokinige for the whole so got start these operations. Nibuchi umamuche but yani from 1937 kinge founded in Tenok Hospital omugo tono ndamun en nema. It has only been the grace. Nibuchi ne kawaida ngebagete welo how do you survive? Olivanda na rabishek chebo biik che gasishek ako mosiche profit. Why? Kinyoru toretet neunonda ako magele sige agine kilelen kilotuge kiagi kilelen kakitoret emenyo.
Okay. Awek tanlet kidogo daktari ngalanen toritoshek anan collaborations kobun serkalishek ab counties ak serikalit neo. Kasarta nekinyo devolution ko kikidevolven sector noton nebo kanyoiset morle en gerengung ye comparean komito kanyoiset serikalit neo ak nguni komito serikalit nebo counties ko keboronje kangeleljinet ab boisionik kobun kibagengeisiek chebo kanyoik ko nebo KMPDU en gerengung une ye comparean ako mara tokchinet nebo sector noton nebo tililindo anan kanyoiset en emetab Kenya kebendi tai kobune.
So, I mean, they will not have go, Kilia sige devolven, kiki devolven sigele, so go iti chi tukul, konya ise ne nyalu no. Kawaida kingo tom get devolven go ki ma tom we developed. Even all the levels, from level 1, 2, 3, all the levels of healthcare. Ko kiki ma se ba, Barabining legamin and all the lower levels as go to our talk. Alagi we got namina going on I got a star with me. Some counties have really done well. So I think they deserve to be to be told thank you because not the be keen challenging and evolution of healthcare go like human resource, how do you manage doctors or all these healthcare personnel that to manage within the county sometimes is a bit of a struggle. And so that is why sometimes people feel like get healthcare from the national level. The other bit no matter we go kia itono ngalega kirip tono ngalega the budget ngoi health ako boys komie ko chitugul kongen eleu sipitali negit ka testoi tono kiboisie rabinik komie mi kerichek mi this medical equipment ngele medical equipment go very expensive from laparoscopy chemuche keat tikole ngibundo konda kidogo age age un operation so those equipment go kali usually go younger pooling resources to the level of national, so when you're a better bargaining power outside the country with this equipment. So there's, it's a balance. Those kite benji tu negasa ngunangele une sibitali section negite enokwe. Kipo ishi rabini komie, kitore TV kyo kalagi ngawalege.
Okay. Chomoa tebenin kutinga shift daktari amoga ngalanen kagas ingolonen engtai. Transition ni kongeten NHIF agoi shift kiko testai goibu tom mami gaguyet komie eng bigab emet ago igere ile nito go kit ne tieme missing President William Ruto koger kole kaisulda komie kobaten yeger kasuldaenyin ko imuch komaisulda komie amu mengen biik amu naet nemotindoi biik ago mite buti kole kolya machul NHIF asikoibu shift anan kong'et tuguk chemito shift chekikere kole kororon koibu ako koyomyo eng komosta nebo NHIF. Maybe eninye tos ikertoi ano all this situation nebo shift?
Mongen ala amuche awal kou ndamun it's not my area, and then angen ale kikobun a lot of consultations, discussions, so I can only read amuche akerit amune sikimoe ke transition. Kimi tuguk chekimoboisie komie, you know, and NHIF. But sometimes ke rebranden kit ko konu, you know, some motivation akoborchi biik kole onge kit komie. So but you know, sait age kou en kong'ung ismelelen kot mochamdosi en kot ko ondewendi kot age komokele, you know, welelokse. So but kibwote kele with this transition we hope for the best. Ingele kigerunen amune siki transition. Kot koityi iman biik konyor the care about cancer care. You know, angalalen cancer ndamun it's one of the ibe a lot of funding, even with this open heart. You know, for a long time kotomine ke ngalale ngalekab prevention ak early diagnosis. So ndamun moe chepkondok chechang koitine every village, you know, komi ngalekab how do you prevent this, you know, kiterto ano mionwogik cheuchu. So more funding needs to go there. In the previous one ko kingalale ngalekab boinyoru any cancer kolipanun operation etenyu, ilipanun chemotherapy chechene kole, ilipanun radiotherapy these sessions. No ngengalale na nyi, ngengalale biik cho ke preventen. That is where we hope we will put the focus on. Age equipen the facilities checho konyor. Koyoma actually kotitindoi a very best insurance cover agiwe level agiwe dispensary. Yeah. Menyoru CT scan, menyoru MRI. Magi admitting sawa. So we hope get transition ke equipen also the facilities chemiten. So much daktari kanan pick to the healthcare professionals kwa kasi nenoto akotoret biik. Yeah. Okay.
Aya, Daktari, maragi looking forward, tos igertoi ano in terms of innovations chetesetai kokwoni boisietab muswoknotetab kasari niwendi kowole for the better or for the best field noton nebo engset and surgery?
In terms of like innovations, but negi ngun negi mogiye negi gerle to, you know, the authority bi anga o amangalale migala telemedicine, you know, care be in different ways, but idea about telemedicine ko imuche, you know, you can actually help people jemi far away, you know, even those rural facilities. When you think of specialists come a certain level, from level 5, level 6, sometimes level 4 hospitals in Kenya. So how do you connect people in the rural areas? They struggle when you access to these specialists and specialized care, not just the people, but also the care surrounding them in the rural areas. So sometimes, if we to empower the rural areas, there has to be a way of even, you know, of this telemedicine. It's not really rocket science. It's actually happening. Okay. We one of the things that cancer Rwanda Moet, for example. No, K invite any specialists all over the world. Maganya nega, Maten nega. No, you open it out. Europe, America, India. You know, again alalengele. Key, what is the best way to get this patient? It's a multidisciplinary team. Nangalalen ago or recommendations. So that's one way. You know, ngalalen. You know, asipagi karorju mgonjwa gele. This is kaya ngalalen ogi bwate gele. Kotienge tu ke the latest evidence ko boru golenan. And then any legimi chigi muje golen. What is the best way? Aga ngalal, you know, komachi mgonjwa gole. Those mock down. So that is one way. The other way go keta star ki invest in training. Okay. Ki training these consultants, whether it's physicians or surgeons. So that investment has to continue. Okay. Like I think next year we are working with Stanford University as well, how we can create simulation. You know, how do you use technology to teach, examine these as they train to be the consultants? Because if you train more, they will reach more people. Yeah. So investing in training is one. It's not really, so it's about using technology to train more people and actually to make them competent. Other things go to robotics. Mago ya wache ngele tindai kanse nored moed. Impage inyor mapema ko imuchi boisien these minimal invasive procedures. Basically gelenen me machi yat ku yat ngeden you know mago lazima. Ni gibara laparoscopy. Wikitindai anteno. Mi gibara robotics mo kitindai anteno. To mod ko it Kenya. So yote lege ipendi. And then finally ko ngalekab kerichek, you know, how elegirta kerichek ko make targetan gele, you know, une DNA nang we target specifically mage going to kerichek because what is considered normal and the general population magele lazima ko normal, you know, age so yaje gele customize and on how do we treat you as you yes not namuna. Yeah, so tuza sawa tu kidogo chamuja kwa teseta lakini na mwana cha mamuja exhaust ni
okay daktari amache getuktini yoto tetutenyo nebo betutab raini mara ngoliot nengung nebo mwisho gewongoti tetutenyo nebo betutab raini.
I think neta macha no kongwe ndamun en tetutiani nebo aeng ko kelenji big, you know, over this wellness check early moto tepte you know, maumivu tago ita appoint ne mogi nyoe nebo somok ko borole onge toret ke toret pikyo ko nguno nenteno ko tumo partneren through this marathon toret itanga single bokol mut ko toret yeleo and yeah so ko toret ak show
kongoi missing kimagun gi age tugul ne kararan peleka salamu ko tenwek.
Asante.
Aya. Noton chitab college ko Daktari Dr. Kimutai Sylvester na gumite aginen eng betutab raini eng tetutenyo nebo tililindo wongeten yuton bo ketesiet nebo Kass TV omongu kainetkei chechang kotinygei ak field niton bo engset anan surgery ak nebo komonut ne komwoe daktari keker kele kakimuch kerutechi ketesiosiek choton chebo kanyoiset anan tililindo keker kele kakimuch kechikilgei mara yeiwe eng betutab raini anan ko betutab karon yeichikilgei ko mengenchi mara ngo kami korotio nemoche kotou ko yeichikilgei kemuch ketoreten mapema. Kainenyu ko Caroline Kiplagat amagun gei age tugul ne kararan testa iker Kass TV amun kimnotet night.